Hello. I will take you into a journey to become a detective of your own chronic and complex condition. Before we begin, I have an important disclaimer to make. This video is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. AI-generated interpretations are supportive tools only. They do not replace a clinical judgment. All findings must be reviewed and validated by a qualified healthcare professional before any medical decisions are made. Never disregard or delay professional medical advice based on content in this video. In case of a medical emergency, contact your local emergency services immediately. With that being said, let's dive in. This is what I've been doing for a couple of weeks or months now, where you might recognize it if you are interested in this video. If you have someone around you, someone you love that is suffering from a chronic and complex condition, and you want to help, or you are this person yourself and you want to understand more what's happening in your body, in your health, I could be helping you by showing you how I've done it myself, how I use generative AI to try to understand better what's happening in my body or in the body of the people that you care about. And I believe that there is many conditions where we see chronic disease or chronic illness are going on the rise. There are more and more affecting even children nowadays. And doctors are, yes, a lot of them are not able to help or very little. And some of them do not even understand what's happening and refer you to a psychiatric. So I've been in this world for now about 10 years, and now I'm very happy that we have AI to try to make sense a little bit more of all the data and all the medical analysis that we can receive from all the doctors we could have seen. So what I will try to do is to show you how you can use generative AI starting from something like this. I would say medical analysis that could have multiple forms. So in here you can recognize some EEG, so brain encephalogram, but also you will find some DNA test. You will find some blood analysis where we looked at so many markers, some specialized tests on the mitochondria side, on the gut bacteria, on all the infections, all the markers regarding bacterial infection, viral infection, parasites, mold, and a lot of immune marker. If you are suffering from chronic conditions, you must have done a lot of them. You must have a lot of them, especially if you have been suffering for a very long time. So here I've got 10 years of data from a child actually here, a child who is 12 now. And what I'm going to show you is how you start from this and you get to something like this. So what you see here is exactly the same data but run through AI. What AI is able to do, AI is not hallucinating here. I breed the AI to work only on the data of the medical analysis of a patient, of a single person. I do not push the the model to go on the internet when he doesn't know. The only thing I do is when the model finds some abnormalities, I'll ask him to explain the rationale while he goes to go on the internet to explain the rationale why he would decide that this biomarker is actually more important than another, or why is it as much as not in range compared to the normal population, and then ask him to find out to what kind of condition he will relate to. So the model that I will be explaining here is how you make sense, or first of all, is to extract all the data that could be from documents who have multiple kind of formats. You can see here I've got some PDF format. I've got sometimes picture, so that are pictures that I took with my phone. Some are pictures where I have actually a document that is on top of plastic because it's in a folder, and sometimes I've got text as well, which is actually the easiest when it's actually a letter explaining what's going on. But when you start from something like this, the AI is able to extract data nowadays, and from that they will extract and highlight the most important item to build a clinical picture on which every decision will be backed up by the scientific literature. And out of that, by using a couple of prompts and the latest AI model that combine text but also images, you will be able to build some presentation or even videos that can provide a lot more understanding, even so that, yeah, medical term will continue to be used, but potentially it will be presented in such a way that it will provide more clarity and you will be able to understand it better. Hopefully, this is then a document that for you will understand why so and so, why do you have now such a medication, what is it for? If you struggle to understand or to spend time with a doctor who actually understand and is able and he has the time to explain you what you are doing and why it takes such and such a decision, or why do you regress because you are in such a situation that your body or your biology is actually weakened, and you have to take some rest. It's because your body is reacting differently in case of, I would say, an infection or a stress. And maybe the reason for that is in your DNA or in some kind of infection or that is underlying and make you weak. So what I will be doing is I will take you through the multiple steps that I do to so extract data from those documents, then make sure that the data is correct, double check, and then running it through one or two or three other LLMs, so AI models, to get to a point where you're very satisfied with the uh, output and you are able to create even something that is on more than just text, to provide a really, really, really good formatted document that you can print or you can send and you can take to your doctor so you can discuss it to check with him if there is not something you have forgotten in your treatment. All right, so I will be doing this with you in another time.